so I'm going to be teaching the overhead squat test, and so this is going to be a useful tool to look at the patient's quality of movement, and then see their impairment, see what needs to be strengthened, what needs to be stretched, and then come up with an appropriate plan for intervention. So we're going to do the overhead squat test. You're going to instruct the patient to have their feet shoulder width apart, and then hands straight up in the air like so, and then trying to keep their chest up, come down into a squat like so. And so then you can look at their impairments. Some common impairments with the overhead squat would be toe out, medial longitudinal arch collapse, so pronation, knee valgus motion, trunk forward lean, and then the arms dropping. And so if I assess him doing his overhead squat, I notice right away that his knees, there's a valgus motion in his knees, so his knees come inward. And so an underactive muscle would be his hip abductors. And so I would work on his glute med. And so one intervention exercise that I would come up with would be either lateral walk. So you'd use a TheraBand, and then you'd have them wrap it around just their upper thighs, if you wanted to do that for me, or upper thighs.
Oh, sorry, yeah.
It's okay.
Yep.
Yep, and then I'll wrap it, and I'll tie it here. And then you're just going to have them, against this resistance, do lateral walks. So I don't know if this will stay here. Okay, so then you'd be in a low squat, and then you do lateral walks against that resistance, strengthening that glute med. And then you can also do a leg lift. So if you wanted to lay on your side.
Yep. Oh, just put the band on.
Yep, you can do that too. Just extra resistance.
Yep.
And then. So what you would do here is you would have him laying here. Oh, I can't even see this.
There we go.
Is that good?
Yep, you're good.
Okay, and then he'd lay on his arm. He'd bend his leg that he's laying on. That one, yep. And then he'd use his glute med closest to the floor to push himself up and do a leg lift with the top leg. So then lift your hips off the ground and the bottom hip so you can use that forearm. Yep, push up. Okay, so then we'd use this test just to strengthen those hip abductors in order to decrease that knee valgus motion in the overhead squat. Oh no.
That's all right.
Oh no. I'm gonna have to edit this now.